Welcome to the Depth Dive. Today we're tackling a really fundamental question about life in India.
Right. How long do people actually live in different parts of the country? It varies quite a bit.
It really does. So to get a handle on this, what sources are we looking at?
Well, we've gathered some pretty solid resources. We'll be looking closely at the latest data from the Sample Registration System, that's the SRS,
Okay, the SRS.
and also the National Family Health Survey, the NFHS. Plus, we're bringing in some perspectives from the World Bank and WHO just for that broader context.
Good, good. Broader context is helpful. And these sources cover slightly different times, right?
Yeah, that's worth noting. The data goes up to roughly 2019-21, depending on the specific source.
Got it. So our mission today is really to figure out where the biggest differences in life expectancy are across India's states.
And crucially, to explore some of the reasons why these gaps exist. We want to give you a clear, sort of insightful understanding of this. It's quite an important aspect of India's story.
Absolutely. So to start painting that picture, what's the overall national figure, and where do we first see those state differences pop up?
Okay, big picture first. The SRS data, that's for 2016-20, puts the average life expectancy in India at around 70 years.
70 years, okay.
But then the NFHS 5 data, which is slightly more recent, 2019-21, gives us a figure that's a bit lower, about 65.8 years.
Interesting. Why the difference?
It likely comes down to, how they collect the data. The SRS uses something called a dual recording system,
Right.
whereas the NFHS is a broader health survey in general.
Yeah.
Different methods, slightly different results.
Makes sense. So when we zoom in on the states, who's consistently doing well? Who's living longer?
Yeah, that's where it gets really interesting. Across these different surveys, we consistently see certain states pop up. Think Delhi, 75.8 years, according to that SRS data.
Wow, quite high.
And Kerala, right there too, at 75.0 years. Others that are frequently up there include Himachal Pradesh, Jammu and Kashmir, Tamil Nadu, Maharashtra, and Punjab. Their numbers are all in the sort of 72 to 74 plus range based on that SRS data.
And it's striking that they consistently rank high across different surveys and time periods.
Exactly. It really suggests there are some persistent fundamental factors at play in those states.
It really does highlight that. Okay, now the flip side, what about the states facing more challenges? Where is life expectancy consistently lower?
Unfortunately, yeah, we see a similar consistency, but at the lower end of the scale. Uttar Pradesh, for example, comes in at 67.4 years.
Okay.
Chhattisgarh is even lower, 65.1. Then you have Madhya Pradesh at 66.5 and Assam at 66.2. Again, these are the SRS 2016-20 figures.
And these states also tend to appear lower down in rankings consistently?
Yes, pretty much. It suggests, just like on the higher end, that there are some deep-rooted issues impacting longevity in these regions.
So a clear geographical pattern seems to be emerging. Let's switch gears a bit. What about gender? Is there a difference between men and women?
Yes. The general pattern, and this isn't unique to India, it's pretty global,
Right.
is that women tend to live longer than men in most states.
Okay. But how big is that gap? Does it vary?
It varies quite a bit, actually. Some states have a really noticeable gap, others less so.
All right. So where do we see the biggest differences? Where are women living significantly longer?
Looking at the NFHS 5 data, so the 2019-21, Nagaland stands out. Women there average 79.9 years, while men are at 71.5. That's a gap of 8.4 years.
Quite a difference.
Even wider in Mizoram. Women at 78.4, men way down at 66.9. That's, wow, an 11.5-year gap.
11 and a half years. That's huge.
It really is. Goa also shows a big gap, over 10 years. And if we look at the SRS data, Himachal Pradesh has a female advantage of about 7.2 years, Kerala around 6.1 years. So
Yeah.
significant gaps in several places.
Really significant. But you mentioned exceptions, places where this trend doesn't hold.
Yes, and this is where it gets quite fascinating. According to slightly older SRS data, 2015-19, in Bihar, men actually had a slightly higher life expectancy.
Really? Men live longer.
It's just slightly. 69.2 years for men versus 68.6 for women. And we saw a similar, though even smaller trend in Telangana, men at 69.8, women at 69.6.
That completely goes against the grain. Any idea why?
It really makes you wonder, doesn't it? Could it be specific socioeconomic factors? Maybe occupational risks, different patterns of healthcare access or use between genders in those specific states? It definitely needs a closer look.
Absolutely. So many potential factors. Okay, let's look at another divide. Urban versus rural. What's the general picture there?
Broadly speaking, the trend is pretty clear. People in urban areas tend to live longer than those in rural areas in India,
And that thinking behind that is?
usually attributed to better access to healthcare, more hospitals, clinics, plus better infrastructure generally, maybe higher income levels in cities.
Makes intuitive sense. What's the national average difference look like?
According to the SRS data, 2016-20, again, it's about 73.2 years in urban areas compared to 68.6 years in rural areas.
So almost a 5-year gap nationally. That's pretty significant.
It is. It highlights a real disparity in living conditions and access.
But I feel like there's another exception coming. You mentioned Kerala earlier.
You guessed it. Kerala, again, bucks the trend. The same SRS data shows rural life expectancy in Kerala is actually slightly higher, 75.2 years, compared to 74.7 in urban areas.
Wow. So the Kerala model really reaches everywhere in the state.
It really seems to underscore the impact of their focus on equitable primary health care and essential services, making them accessible regardless of whether you live in a city or a village. It shows policy can make a difference.
It's a powerful example. Are there states where that urban-rural gap is particularly wide?
Yes, definitely.
Yeah.
Assam stands out quite starkly. Urban life expectancy there is 73.0 years.
Okay.
But in rural areas, it drops to just 65.1 years.
Yeah.
That's a difference of nearly 8 years. Huge.
8 years, just based on living in a city versus the countryside in the same state.
Exactly. Jammu and Kashmir also shows a noticeable gap over 5 years difference between urban, 78.1, and rural, 72.7. It really drives home how much location within a state can matter.
So we've mapped out the variations. Now let's try to unpack the why. What's behind the success stories? Let's start with Kerala again.
Okay, Kerala. The Kerala model is really key here. It's this long-term focus on human development. Think high literacy rates, which empowers people.
Right. Education plays a role.
And widespread access to healthcare, especially good primary care. Plus, there's been a historical emphasis on social equity, state investment in health, clean water, sanitation, and even a strong public food distribution system.
So a whole package of interventions working together.
Pretty much. It creates a strong foundation. But it's not perfect. There's the Kerala paradox.
The paradox, what's that?
High life expectancy, yes, but also a higher prevalence of lifestyle diseases, heart disease, diabetes, hypertension.
So longer lives, but perhaps not always healthier lives in later years.
Exactly. It highlights a shift needed towards more preventative care for those chronic conditions now.
Very interesting nuance. Okay, what about Delhi? High life expectancy, but seems like a different story.
Very different drivers, yeah. Delhi benefits massively from being the capital, a huge urban center. There's a high concentration of advanced medical facilities, top hospitals, specialists.
So access to high-end treatment.
Correct. That definitely helps in treating serious illnesses and potentially extending life. But, and it's a huge but,
Air pollution.
air pollution. It's a massive issue in Delhi. The consistently poor air quality is known to hammer respiratory and cardiovascular health. It likely shaves years off life expectancy, perhaps offsetting some gains from healthcare.
A serious counterweight.
And there are also big socioeconomic disparities within Delhi itself. Access to those fancy hospitals isn't equal for everyone.
So a real mix of advantages and significant challenges. What about other high performers, like Himachal or Punjab? Any quick thoughts?
For Himachal Pradesh, it might be linked to better rural healthcare delivery compared to some other states, and perhaps a generally healthier mountain environment. Punjab likely benefits from better socioeconomic indicators historically, meaning better nutrition, better access. Though, like Kerala, it's also facing challenges with lifestyle diseases now.
And Jammu and Kashmir.
Likely a mix of sociocultural factors and how healthcare access works regionally, though we need more specific data to really pin it down.
Okay, got it. Let's turn to the states with lower longevity now. What are the main hurdles in places like Uttar Pradesh and Madhya Pradesh?
In UP and MP, the lower life expectancy figures are strongly tied to factors like widespread poverty, lower education levels.
Kind of the mirror image of Kerala's strengths.
In many ways, yes, and critically, limited access to quality healthcare, especially, as you mentioned, in rural areas.
Right.
And these states also tend to struggle with higher rates of infant mortality. That's a really big factor we need to talk more about.
We will. What about Chhattisgarh and Assam? Any specific issues highlighted there?
Chhattisgarh has shown particularly high mortality rates in rural areas, which pulls down its average. In Assam, things like widespread anemia and poor diet are often pointed to as significant contributing factors.
So it emphasizes that the specific challenges can vary, requiring tailored solutions.
Absolutely. Targeted interventions are likely needed for each state's unique situation.
You mentioned infant mortality a few times now as being crucial. Can you break down exactly why it impacts the overall life expectancy figure so much?
Definitely. The infant mortality rate, or IMR, that's the number of babies dying before their first birthday, per 1,000 live births, has a direct, almost mathematical effect on the average life expectancy calculation.
How so?
Well, if a significant portion of the population dies very young, it dramatically lowers the average age at death for the whole population.
Right.
Think about it. Every infant death pulls the average down significantly.
Right, drags the overall number down.
Exactly. And we see this connection very clearly in the data. States with lower life expectancy, like UP and MP, they consistently have higher IMRs.
And the reverse is true for states like Kerala.
Precisely. Kerala has a very low IMR and a high life expectancy. It really underscores how vital interventions are that focus on maternal health, safe childbirth, childhood vaccinations, treating common illnesses early. All of that is critical not just for saving babies' lives, but for raising the overall life expectancy.
Makes the connection crystal clear. Now, we can't really discuss health trends without touching on the huge disruption of recent years, COVID-19. What impact did the pandemic have on these numbers in India?
Oh, it had a significant impact, a negative one. There was a noticeable drop in life expectancy across India between 2019 and 2020 because of the pandemic.
How big a drop are we talking about?
Studies, including some analyzing NFHS5 data and other models, pointed to an overall decline. Some estimates put the reduction at around 2.6 years during that peak period.
2.5 years lost, essentially, in a short time. That's substantial.
It really is. It was a major shock to the system.
And was that impact felt evenly, or did it hit some groups harder?
It seems the impact was uneven. Evidence suggests that certain groups, perhaps based on gender or socioeconomic status, might have been disproportionately affected. Some research hinted at a possibly larger decrease for women, for instance.
More vulnerability there, perhaps.
It's complex.
Yeah.
But it's important to see this, hopefully, as a sharp setback within what has otherwise been a long-term increase in life expectancy. But it definitely exposed some vulnerabilities.
Right. So, speaking of that long-term trend, putting COVID aside for a moment, how has India done overall over the decades?
Looking at the longer historical view, India has actually made really impressive progress. If you go back to, say, 1970-75,
Okay.
the average life expectancy at birth was only around 49.7 years, just under 50.
Wow, that's low compared to now.
Exactly. By 2015-19, so just before the pandemic hit hard, that number had climbed substantially to about 69.7 years.
That's a 20-year increase. That's
Yeah.
massive progress.
It is, and it reflects huge strides in healthcare, better sanitation, hygiene awareness, improved living standards overall. The country has come a long way.
But as we've spent this whole discussion exploring,
Those gains haven't been shared equally everywhere. The regional gaps, the disparities we've talked about, remain a really key challenge despite that overall positive trend.
okay, so let's try and wrap this up. What are the main takeaways for our listeners about life expectancy across India?
I think the biggest takeaway is just how significant and, importantly, persistent these differences are between states. How long you live in India really can depend quite a lot on which state you're born in.
And it's driven by a whole mix of things.
A really complex mix, yeah. Healthcare access and quality are huge, obviously, but so are underlying socioeconomic conditions like poverty and education, lifestyle factors, the environment you live in, and even things like gender and whether you're in a city or the countryside. It all weaves together.
So, for you, the listener, we hope this deep dive has given you a much clearer picture of these really critical health differences across regions in India and, the many interconnected factors driving them.
It's a complicated picture, for sure.
Definitely. And to leave you with something to think about, India has made amazing progress over the decades in helping people live longer lives, even with the recent pandemic setback. So the question is, looking forward, what specific targeted actions, maybe at the state level, maybe national, do you think could have the biggest impact now? What could really help close these persistent regional gaps and ensure healthier, longer lives for all Indians?
That's the crucial question, isn't it? There are so many layers still to unpack and consider there.